Hello, I'm Soumya Sharma and I'm going to discuss all about hair loss treatment analysis. So the question arises now, do hair loss really irreversible? Not to demotivate you all, but it's fairly not possible to reverse hair growth. Yes, in certain conditions, it's applicable, which we will discuss later on in this video during treatment analysis. But it's not possible to repair damaged hair follicles. See, medical treatment slow down the hair loss process, but they don't repair the damaged or dead hair follicles. So it's really impossible to go back to the formative years of your hair texture. So now let's discuss about medical management, and later on we will discuss about surgical procedure. In men, the front hairline tends to recede, or they might have thinning at the temples or the crown on the top of the head. In women, it can involve scalp or affect certain areas such as parting of the hair or the temples. So, usually, the first line treatment involves Rogaine, which is also known as Minoxidil, which was earlier used for hypertension. Well, now it is used for hair loss treatment, which can be taken as orally or applied topically. Usually, it comes in bottles containing 2%, 5%, and 10% solution. It is applied twice a day. 5% is usually more effective than the 2% one, but used quite rarely due to its greasy formulation. Its general efficacy is 60%. It helps in short term hair growth, but usually fails to deliver longer results, as after few years body resists the medication. Side effects involving these medication could be acne at the site of the application, burning sensation at the scalp, redness, and swelling on the skin. Next is finasteride, which is also known as Propecia. This medication is a steroid which is used to treat pattern hair loss. It is taken as orally, but there are topical formulation as well. The efficacy is same like minoxidil. The side effects are generally related to sexual drive of a person, such as low libido level, inability to maintain erection, problems with ejaculation, but it is dependent to person. And the combination of both Propecia and Rogaine have shown desirable results, extending the efficacy at least to 90%, and it could be more. So it is topically applied. Wash your hands before and after the application. It should be directly be applied to the scalp area. Wash with cool tap water if it comes in contact with your eyes, nose, or mouth. Do not shampoo or blow dry your hairs for at least 4 hours, as it can reduce the effectiveness. As it's a combination of a steroid with a vasodilator, it can always give few side effects. So always take them under dermat supervision. Nizoral and klorane shampoo with quinine can be used twice a week to reduce dandruff or any yeast formation. Along with these medication, chlorine is generally preferred more as it reduces scalp inflammation and burning sensation and slow down hair loss. It is generally left for 5 minutes on the scalp before pouring down the water or washing your hairs down. So these topical medications are treatment to slow down the hair loss, as it can regrow your hairs for temporary period of time. But if you can't afford transplantation and want to stick to these hair or oral applications and want your hairs be intact until late 40s or early 50s, take at least 8 glasses of water daily, maintain your HB, take multivitamin or have a look on deficient vitamins you have, exercise, eat healthy. So to cut short, don't stress, enjoy your life. It sounds very easy, but quite difficult to maintain, as hair loss builds complex, and complex stresses one out. But to keep your hairs in check, managing stress is important. So while taking these hair loss medications, if you make your life disciplined, as told earlier, you can keep your hairs intact for as long as you want. These medications don't work if hair follicles are dead, as there is no cure for the hair loss. But sometimes it can give back your hairs like formative texture only if hair loss is induced via medication or you have an infection which is now resolved, or hair loss related to pregnancies, thyroid, or diabetes could be reversed along with some cases of alopecia. Only in these certain conditions hair loss could be reversible. So this was all about medical treatment analysis. Now we will discuss about how to harvest new hairs, which is surgical procedure. Let's see through it. So talking about the hair plantation, at an initial consultation, the surgeon analyzes the patient's scalp, discuss their preferences and expectations and advises them the desired approach. So this is known as preoperative assessment and planning. Transplant operations are performed on patients with mild sedation or local anesthesia is injected into the scalp. So basically there are two major techniques for harvesting hair follicles. First one is follicular unit transplantation, FUT, also known as strip harvesting. So here now the surgeon will use scalpel. It's a tool which scrapes out the dead tissues or scrape out the skin. So scalpel is used to cut out a strip of scalp skin from the back of your head where hairs are present. The incision is long and linear line. This is then closed with the stitches. The surgeon will cut the separated portion of the scalp in small section using magnifying lens and surgical knife. Now these grafts will be implanted in certain pattern, giving you realistic hair growth. So it would not look artificial. This method leave a thin scar and could be permanent. It is permanent actually, but will be covered when hair grows out. The staples will be removed after 2 weeks of the procedure. So next talking about is FUE, which is known as follicular unit extraction. It is more of an advanced hair transplant method. Advantage of this is that you can pluck out hairs from any part of the body and implant, which in previous one we couldn't do that, and it has less chance of infection also. So here the surgeon make tiny holes with the punching tool. After numbing scalp, the punch tool will extract hairs. It will extract hair grafts from the desired area. Small holes will be created where hair loss has occurred or if bald, then on the entire scalp. The surgeon now inserts the hair grafts into these holes. Now head will be covered with gauze and bandages dipped with disinfected solution. The bandage is removed the very next day only. So on the day 2, it will be removed. The results of the transplantation are impressive, not immediate. So you have to wait to see the long lasting effects for at least 6 to 18 months. So special note, any kind of hair procedure, topical, oral or surgical, will first shed your hairs out and then works in your favor. So it's a very normal process. Do not worry. Please subscribe to my channel if you want me to take more such topics, or even you can recommend me topics that you like.